Hi, my name is Yvonne Garton. I'm the Nurse Care Manager here at Carolina Advanced Health. In our previous video, we talked about when to call the doctor. And today, we're going to talk about how to manage your cold or flu symptoms at home. You've already determined, okay, I think I have a cold virus. What do I need to do now? So, please direct your attention to the PowerPoint presentation. There you go. We're going to increase our fluid intake first. Please, please, please do not underestimate the value of water. It helps to thin out those secretions, keeps you hydrated, provides enough fluid for your cells to do all the work that they need to do to make you better. Ibuprofen and or Tylenol for fever, aches, and pains. You can alternate those. Ibuprofen you can take every 6 hours and Tylenol every 4 hours. And that will generally bring down a fever and deal with some of those aches and pains that come along with a cold virus. Rest. Lots of rest. Lots of times people will attempt to continue to go to work and continue doing things around their home and just really end up making their body more tired and unable to fight the infection. So provide yourself with some rest at the beginning. It will significantly shorten the length of time that you are down and out with a cold and flu virus. Now for some medications. There are lots of good over-the-counter medications. Not everything works for everybody. So you have to try a few different ones sometimes before you find what works well for you. There are daytime cold and flu preparations. There are nighttime cold and flu preparations. The daytime medicines will help relieve some of those symptoms without the drowsiness. The nighttime medicines will cause some of that sleepiness that you'll feel after taking the medication. So you probably need to make sure you're at home when you take those. There's some specific types of ingredients you want to look for. You want to read your labels. Expectorants. These are medications that help to get those secretions out of your body. Cough suppressants will keep you from coughing, hopefully. The only thing is, if you have secretions in your lungs, you want those actually to come out. So make sure that if you've got some fluid issues going on, that you use the expectorant. The cough suppressant is more for those nagging kind of scratchy coughs that keep you up at night. Decongestants, those are also very good for helping to drain secretions from our sinuses and things of that nature. And then there are antihistamines. Antihistamines are very good for allergic type of sinus problems. I would avoid those until the very end of your cold and virus time period, only because they dry the secretions and you can end up with the secretions drying in those nasal passages. And we actually want that stuff to come out and get out of your body. So I would wait to use those towards the end of your illness when you're basically on the mend. Last but not least, remember, colds are caused by viruses. Flu is caused by viruses. Antibiotics are not effective against viruses. They are used to kill bacterial infections. Cold and flu viral infections can last anywhere from 7 days to 2 to 3 weeks. The symptoms may not be as bad in the second week as they are the first week, and likely they won't be, but they may hang on. You may have that little nagging cough or that little bit of sinus drainage, something that hangs on for several weeks. Your body will fight off and kill that virus. That's what your fever is responding to. Your body just launches an immune response and will kill off that virus, and you will return to normal. Good nutrition and regular physical activity will strengthen your immune system better than any medication out there. So the best way to deal with the cold and flu is to not get it in the first place. So make sure that you're taking in a lot of water and that you're eating lots of fruits and vegetables, limiting your simple carbs, and making sure that you're getting your regular physical activity. It will strengthen your body and you'll avoid those colds and flus. Good luck to all of you. Thank you for your time.